One of the tests that we're now working on, we're going a little bit beyond the regular testing in our clinic as well. We're talking about prevention as well. I mean, it's one thing to treat a disease such as breast cancer, bowel cancer, whatever disease, while you have the diagnosis. What about preventing it? And a lot of money is being spent on the treatment of disease, but I don't think enough money personally is being spent on prevention. For example, there's a test called an Estinex test. And a woman comes to my office whose mother died of breast cancer, her mother's sister died of breast cancer, she has a sister who has breast cancer, or a cousin who has ovarian cancer. My red flag goes up immediately, and I'll do an Estinex test. What is an Estinex test? Well, remember I showed you that beginning slide with the estrone, estradiol, and estriol? Remembering that there's 3 estrogens. Remember, there's only 1 progesterone, which is, by the way, the hormone that should have been fallen in love with, not estrogen. Progesterone is protected. There was a guy named Chang in 1995. He did a test where he rubbed some estrogen cream on a breast, and the mitotic activity of the breast increased 200 times. If you rub progesterone and estrogen on the breast, it's now 100 times. But here's the fascinating part of the study. If you put progesterone cream on the breast alone, it is less mitotic activity than a person who has placebo. So I think progesterone was put into the body to protect the body from the estrogen dominance, the growth that causes by estrogen. So I think progesterone is actually the great protector of breast cancer. And I have breast cancer patients on progesterone. Very controversial subject, but really when you're looking at your estrogen levels, Estinex will test your indication of what you are doing with your estrogen. For example, is what's called the 2:16 ratio of pathways out of estrone. Remember I showed you estrone with a green pathway down to estriol? Okay, well that's the safe pathway. That's called the 2-hydroxy pathway. The red pathway going over to estrone sulfate, which fuels breast cancer, is the bad pathway. So if I put your number 2 over your number 16 and come up with a number, the higher that number is, the less likely you are to have bad estrogen. The more likely you are to be excreting estrogen in a safe pathway. Normal is 2 to 8. So if I do an Estinex test on you and you're 1.7, then I give you a supplement such as Breast Health, which contains indole-3-carbinol, what we'll see is your test will now become a 2.5 or a 3.5. So we now know, it's not guessing, we now know that you're using a safer pathway, and so what possible bad could that be? Is to have your estrogen leave your body quicker and not be stored as estrone sulfate. So these are tests that we're beginning to use as preventative markers. And we also, you know, after the horse is out of the barn, so to speak, we also test people who have had breast cancer and find they have very low levels of 2:16 ratios. But we can improve them. We can improve them using things such as indole-3-carbinol. The Breast Health formula that we use has 9 different components. It has calcium carbonate. Remember I told you that the membrane is wrapped by like a bit of cellophane? Well, calcium carbonate actually stabilizes that membrane and allows the estrogen to be excreted out of the body. It also contains components that have milk thistle in it, and vitamin D in it, and schisandra, and flavonoids, and lignans. And so what are lignans and what are flavonoids? Well, what they are, they're competition for estrogen receptors. And it's a good thing to have competition. It's always a good thing to have a little bit of competition, because if the receptor is blocked by a weak estrogen, like flax, for example, it's not able to pick up bad estrogens, xenoestrogens from the environment. So we're learning this now. And allopathic physicians and allopathic journals are beginning to pay attention to prevention. I use CoQ10, for example, antioxidant. Very, very important. Anybody on Lipitor or anything of those drugs, I think that CoQ10 is extremely important. We're almost out of time. We're going to have some questions. One thing I would like to do is thank FemMed. You know that physicians give lectures for drug companies all the time, so I think this is a wave of the future. I want to thank personally FemMed for putting together a talk. It's very difficult to put these things together and bring people in the room, a beautiful evening like this, and I applaud you all for coming. Education is power. I mean, you make your own decision. You will know what sounds like the truth. If a physician, Joel or myself, tells you anything that sounds right, it will feel right, and you'll follow that path. If your own physician or your own intuition tells you this doesn't feel right, don't do it. If you're handed a prescription, a drug, doesn't feel right, don't do it. Your physician may mean well, but if your intuition tells you that's wrong, you're more likely to be right than the physician. So always follow your intuition. I want to thank you very much, Shauna and Stevie, for putting this together. I applaud you. Thank you.